Hi there, it's Tammy here, and in this short video, I want to talk pregnancy and powerlifting. And this video is kind of a continuation of my Pregnant Athletes are Outliers video, after being sent a reel of a pregnant powerlifter competing in a powerlifting competition at 30 weeks pregnant. And well, because of course the conversations being had at the moment about pregnant athletes seem to be continuing with posts like these being shared, which is great because it opens the door for conversations like these. Now, this post that I was sent has got a huge amount of comments because, well, to be honest, it's actually pretty controversial. And there are certainly two sides to this argument, which is absolutely reflected in the comments on this particular reel, as well as the comments that I received about this particular video. And I'm actually going to try and explore both sides here. And on one side, she clearly is a strength athlete. In fact, she's actually on her country's national team, which means that she competes internationally in her sport. And please remember, this places her in a different category from general population pregnant women, or general population in general, because she's an athlete. And based on my knowledge of powerlifting, and let me be clear, I'm not a powerlifter. I've never competed as one. However, I have known a number over the years, and I have been to quite a few powerlifting competitions. So I have kind of a reasonable grasp on this, right? But basically, as a strength athlete on her national team, meaning that she represents her country in this sport and competes in this sport internationally. But she would be strength training 4 to 5 days per week consistently, right? And consistently following a structured training plan that cycles depending on how close she is to competing. It also means that the classic powerlifting lifts of squat, bench, and deadlift are literally ingrained in this woman's central nervous system. So on the other side is the question, should she be doing this during pregnancy, and is this dangerous? But as a very wise woman once told me, is that there's always three sides to anything, because somewhere in the middle of these two sides is actually the truth. So I'm going to give my perspective on this in this video. And firstly, this woman is clearly extremely strong. I mean, I'm strong in a general sense, but this woman is professional level strong. And it's important to remember that strength is relative. So what is heavy for one person is going to be totally different to the next. And of course, body weight plays into this as well, right? So her squat in this particular competition was 180 kilos. Her bench is 105 and her deadlift 205. And she competed at just under 84 kilograms, right? And I've checked out her stats, and she normally competes in the 76 kilogram weight class. So there's already an increase of 8 kilograms, so at a weight difference of 8 kilos. And that's standard good pregnancy weight gain if you ask me. But it's important to remember that the more you weigh when it comes to powerlifting plays into how much you can technically lift, right? So the heavier you are, you should be able to lift more. But like I said, I have checked out her stats, and she's actually ranked 8th in the world in her weight division. And if you ask me, that is no mean feat. I mean, she's the 8th strongest woman in the world in her weight class, right? And her non-pregnancy stats look like this. She's got a 207.5 squat, 100 kilo bench, and a 210 deadlift. And her squat in this particular meet was sitting at 86%. Her bench, yes, it was heavier, and her deadlift was sitting at 97%. And remember, these are all based off her last competition, which was 9 months prior. And she would have continued to train during this time, and very likely she would have gotten stronger. And remember, she weighs a little bit more as well. And just to give you a comparison here, looking at her stats based on her comp before the one I'm referencing, which was 3 months prior, she actually added 27.5 kilograms to her squat, 7.5 kilograms to her bench, and her deadlift I think was about the same. So she added that in a 3-month period. And there was 9 months of probably very solid training between her last meet and the one shown in this video, along with that 8 kilogram increase in weight. And based on the comments that I've read during this competition, you know, she ensured that she stayed within a weight that she could easily do for 2 to 3 reps on any given day during her pregnancy. And her RPE, or rate of perceived exertion, was about an 8, which is about right if she could do that weight for 2 to 3 reps, right? And it's also important to remember that powerlifters work off their RPEs every single session, and they absolutely have to give this feedback to their coaches for every single lift of every single session. So for her to say my RPE was an 8, then I absolutely believe her that that's how hard she was working. Now, a few other things that I think are important to note. She's not wearing a belt. So the intra-abdominal pressure is going to be different than when using a belt and the Valsalva maneuver, which pushes pressure out into the belt. Now, I can't comment on what breathing technique she was using and whether or not it was open or closed glottis. And of course, I go into much more detail on what this is in the pregnancy process program. And it's too complex to go into here, but just so you know, during birth, an open glottis breathing technique is recommended. Now, another thing to think about is the fact that she would have had a pretty good idea going into this competition how she was going to place based on how she'd been training up to that point, how far she could safely push herself, and the other people competing in the competition. Because, you know, you can see the stats for people's lists. That's how I got her stats before. So from this perspective, maybe she was working a little harder than she technically should have been, but we also have to understand that athletes are extremely in tune with their bodies and their body's capabilities on any given day. Now, also her training cycle didn't peak for the competition as far as I know, and I'm guessing that she wouldn't have dieted or done any kind of water manipulation to make you wait for the comp, right? She would have known her weight going into it and what class she could compete in. And she wasn't lifting to her 1RMs. She wasn't wearing a belt, and she was used to lifting these kinds of weights, which you can kind of clearly see in the video. There was actually no grind in any of them whatsoever. I mean, the lifts go up pretty smoothly and pretty easily. And she clearly has a lot more in the tank than what she gave on that particular day. So it's possible that she just decided to compete based on how she'd been training, knowing where her lifts were sitting and what her weight was doing close to the comp. You know, she just turned up and did what she loves doing. Remember, she is a national champion and competes internationally. She is not like you and me. And again, while we can draw inspiration from this, we absolutely cannot be adopting these methodologies into general population pregnant women's training routines. And as athletes and influencers, they need to be coming from a place of responsibility and not encouraging pregnant women to do this either, right? Now, if we look at this from the is it dangerous camp, you actually have the heavy lifting and its effect on everything from, say, blood pressure to changes in hormones affecting joints and ligaments in the pelvis and spine. And then, of course, the stability of these joints under heavy loads. So again, you have the joint and ligament stability factor. Then, of course, you have the effect of full range squats on the pelvic floor. But we also need to remember that we don't know what breathing technique she was using, and we don't know if she was actually contracting and holding her pelvic floor as she was doing her lifts. All I can say is that I hope so. And when it comes to her pelvic floor, all I can say is thank goodness that she wasn't sumo deadlifting. Because you know how I feel about that. But then, of course, she was benching flat on her back, which isn't recommended due to venous return and the inferior vena cava syndrome. And listen, she was potentially working a little bit harder than she should have been. You know, I believe that her RPE should be around a 7. From these perspectives, as a pregnancy and postnatal specialist strength coach, would I say she's sitting outside of the guidelines? Yes. And I probably wouldn't recommend this personally. But again, you have to remember that pregnant female athletes are always going to be outliers, which is why we cannot compare them to the general population and why we cannot be adopting their training methodologies. They just aren't like you and me. So like I said at the start of this video, the truth is probably sitting somewhere in the middle. Again, would I recommend this? Probably not. But then again, I'm not her coach. You know, I have trained a strength athlete during her pregnancy, and I will tell you, she was capable of doing some absolutely incredible things. But you know, she wasn't competing, and she didn't need to maintain an international competition level strength throughout her pregnancy. So again, this is totally different. And another interesting perspective that was shared with me recently, and something that I think is really important, and I think we all need to think about, is what's more unsafe? You know, a national champion who competes internationally, continuing to do her sport throughout her pregnancy under the strict guidance of coaches and hopefully a specialist women's health physio who helps her deal with the pelvic floor, but that's a totally other topic. Or, you know, being sedentary during pregnancy, not doing any exercise at all, or being obese during pregnancy. I mean, we need to think about what carries more risk for the mother and the baby. This or being obese? This or being sedentary? So as this conversation continues, I think that we should be encouraging women to train during pregnancy. And if you don't know the difference between training and exercising, please head to my page and find that video, because there is a very important nuance right there. And I think that we should be educating women around what's safe for their bodies. I think we should be minimizing the comparison of one woman's pregnancy journey to another. But especially, let's always remember that pregnant athletes are outliers, and us regular people, we cannot be comparing ourselves or our pregnancies to them. And please, while finding inspiration from them, let's leave this type of thing to the professionals, as opposed to actually adopting their pregnancy training methodologies ourselves. And athletes, I ask you to please not encourage general population pregnant women to follow along with your training, because in my eyes, this is what's irresponsible, not you training the way that you're always used to training. So that's it from me today. I hope this video helps. And if you want to join this conversation further, please feel free to join my private community that supports women throughout their pregnancy, health and wellbeing journey. The link's in my bio. So that's it from me today. I hope this video helped, and I'll see you in the next one.